Okay, hi, my name is Allison. I'm a student nurse from Western University of Health Sciences. I'm going to be helping with finding nurse care today. First, I just need to take your vital signs and ask you about how you're feeling and how you're feeling today, okay? Yes. Okay. So the first thing you're going to do when you walk into the patient's room, you're going to lift up, you're going to look at the arm again. I'm going to say, please tell me what's your name is. And take your date of birth. Okay, and you check that it matches on the armband, and then you check your own records to make sure it matches. And then we're going to go over the vital signs. So I'm going to be taking your vital signs today, and that includes your blood pressure, your pulse, measuring the oxygenation in the blood, pulse off, your respiratory rate, and your what route do you want to do?
Any route, if we don't have thermometers.
Oh, okay. So then say, I'm going to take your temperature orally or if you do temporal, either way. So your considerations, for your oral temperature, you're going to wait for 10 minutes if they've had something hot or cold to drink, or if they're a smoker, you're going to wait 2 minutes. And then for, well, not rectal temperature, reasons that you would do a rectal temperature is if patient is comatose, if they're confused, they're in shock, or a mouth breather because it's not going to register properly, it's not going to get their internal temperature. Okay. And then, okay. So then for the blood pressure, you're going to get your test and you're going to measure it to make sure it fits on their arm. Wonderful. Pass around. So I'm going to place the stethoscope right where I can feel her pulse. And make sure you can visibly see your needle on top of the cuff. And you should be listening to their pulse this entire time. And once you can't hear their pulse anymore, you're going to go 30 millimeters above that. Listen to when your heart beat begins. And then so her blood pressure was 106/74. Okay. And then the next thing you want to do is check their pulse and their respiration, which you're going to kind of do at the same time. Can I have you do this? And I'm just going to hold this here for 1 minute. I'm going to count for a full minute because I'm a nursing student. I know it seems like a long time. I have to. So you're going to stand, you're going to watch your watch go around for a full minute, and you're counting their heartbeat right here. And you do that for, do you want to do full 60 or 30?
Full 60.
Full 60 for each? Okay. So the first time around, you guys are going to be doing a full 60 seconds for their pulse. So you're going to be holding their hand for 2 minutes because then during the second minute, you're going to be watching their respiration. The key for respirations is you don't want to tell them that I'm watching your chest rise and fall, because then it alters their respiration pattern. So do that for a full 2 minutes. And then, so your contraindications for your blood pressure. You want to check on their arm. There's different things that, like if they're having pain on their left arm, you're obviously not going to take it. If they have what's called a PICC line in, you're not going to do it. If there's a peripheral IV there, and if they've had a mastectomy, whichever side they've had it on, you don't want to do that side. Okay. And then you guys are all going to do a full 60 seconds for their heart rate, but if it's irregular, that's the other indication that you want to state. You have to count for a full 60 seconds. For infants, you want to count their brachial pulse. And then pulse ox is a little thing that you're going to place over their fingernails. And your contraindications for that is if there's a delayed cap refill, if they have nail polish on, you need to remove it because it's not going to read it properly. And if they have carbon monoxide poisoning or lung disease, it's not going to read properly also. So you need to ask and make sure that those things aren't happening. Pain assessment. So we're going to go through old cards. So I'm going to assess your pain. Are you in pain right now? Okay. Can you tell me when it began?
Like this morning.
Okay, so that's O for your onset. L is location. Where exactly is it hurting?
Like my knee.
Okay. And duration, is it a constant pain or is it, I mean, you don't think
All the time.
all the time? Okay. Okay. And then characteristics, can you, in the best words you can you describe it for me?
It's like a throbbing pain.
Okay. And then A is alleviating factors or aggravating factors. So what have you done that makes the pain go away or feel better?
Like when I ice it.
Okay. Any medications that you take?
No.
Okay. And then what aggravates it or makes it feel worse?
Walking.
Okay. And then R. Radiating. So you're going to ask, is the pain radiating anywhere, which means if it's like traveling up their legs to their hip or their elbows to their shoulder or whatever. So is your pain radiating anywhere? Localized pain? Okay. T is time. So is it hurting worse in the morning or in the afternoon?
Well, it just started this morning, so.
Okay, so it's just been all day. Okay. And have you ever noticed that there's any seasons that it hurts more or less, like during the winter or the summer or anything?
No.
Okay. And then S is severity. So from a scale of 0 to 10, 0 is no pain at all, 10 is the worst thing you've ever been in your life, what would you say your pain is?
Like a 7.
Okay. So I'm going to document all this down. And that's it. So then when you're leaving your patient, you're going to say, okay, is there anything else I can get for you right now? Okay. You're going to make sure their bed is at a lower position, that their call light is within reach. You wash your hands, and then you